the next question. What can you do that has not already been addressed by the Obamacare to improve the quality of health care for the people of District 7? And we start with Randy Camacho.
Well, first, I really like some of the conditions that have been set in the Affordable Care Act. For example, dependents being able to stay on your health care program until they are 26. I also think the other part that is that I think is very important is the pre-existing conditions, and that you cannot be turned down for pre-existing conditions. So I really think that those are positive steps forward in giving Americans access to adequate health care. I do think that we need to consider the fact that the Affordable Health Care Plan it's still early in its making. And the individual mandate is a major sticking point for many people. And I think President Obama has seen that, and that's why he's put it back another year. But eventually, this is a lot like car insurance. And with car insurance, the more people that are involved, the lower the costs become. And that's what we need to understand with regards to health care coverage and health care insurance in America. That's why it's expensive right now, because not everyone is on board yet. But the more people that join, the less the cost.
Thank you. It was a pleasure working in the State House to expand Medicaid. It's one of my proudest moments working with Chad Campbell and even Republicans across the aisle to get more than 200,000 people insurance. But one of the things that I think we really left a hole in is to take care of our undocumented community. They're not eligible for Medicaid. They're not eligible for Obamacare subsidies. They could buy in, but they're not going to get any subsidies. So we need to create a network of support system, healthcare clinics, that's going to be responsive to that community, because we, like my family, we have a very mixed family of different people in different status. And if you have one person that's sick, it could really have a tumbling effect on everybody else. Two, graduate medical education has been severely lacking here in Arizona. Unfortunately, the Republicans in the State House have cut a lot of funding for graduate medical education. So we actually have are going to have a severe doctor shortage. So we, as a federal government, should work through the University of Arizona Medical Campus to bring more direct subsidies for graduate medical education so we can have more residency programs here. Lastly, we should also try to bring as much research dollars to new cancer centers that will be opening up in downtown Phoenix. They could be used as clinics to treat a lot of our poor and indigent. They cannot afford some of the sophisticated cancer treatments. And I think that would also help spur the economy at the same time.
Okay. Mr. Moffett.
I believe that one of the first things that should be done, and what I will do in Washington for you as your congressman, is give you access to appropriate and cutting-edge health care facilities. If you look at Arizona's 7th Congressional District, South Phoenix, Maryvale, downtown, many of our facilities are aging, with the exception of St. Joseph's Medical Center, Good Samaritan, and other hospitals in the district. There are large portions of our district that are just simply too far away from adequate medical care. My grandmother died of a stroke that she suffered. It took 31 minutes to get from her house to a medical center, St. Joseph's Medical Center. She lived on Central and Dobbins at the foot of South Mountain. It's important for you to have a congressman that's going to fight in Washington to build a health care facility for you, be it a public-private partnership or an earmark, pork as they call it, on the ends of a budget. Come hell or high water, we need access to a level 1 trauma center in Arizona's 7th Congressional District. Obamacare, the Affordable Health Care Act, which is its proper name, is working. It is working. I've talked to small business owners who are saving monies in terms of coverage for all of their employees. But you need access to care. And in order to buy insurance, you need a job. So vote for me. We'll build this hospital together, put our community to work, and be able to have access to adequate care.
Mr. Manuelson.
Thank you. I believe first there's a short-term plan, and a lot of folks just are not educated about the Affordable Care Act in terms of registration. Many folks that live in the district do not have computers at home or internet connection. So what steps should we take? Just like with regard to the census, the administration needs to hire folks to go door to door and talk to the people and get a census of who's actually a legal permanent resident and a U.S. citizen, or maybe you have some temporary immigration status that allows you to register for the Affordable Care Act. And we just have a lot of people in the community that don't have access to that information. Two, I would engage, because I work with social service agencies, Chicanos por la Causa, Friendly House. We have the services in the community to hold events, to invite people to register there, to work with counselors, and to be able to purchase their insurance. Once people have access to this information and the power and the knowledge, they'll register, and we'll see greater numbers in terms of registration, and the program will be more effective. I agree with Mr. Maupin here. We need more infrastructure for our city and CD7. But we also must take into account, we have the U of A Medical School, we have a physical therapy program from NAU, we have TGen, we have important hospitals here. What we need to do is engage the universities, and we need to have more nurses in our community. We need to build a medical corridor. We need to have the engagement of the Arizona Bioscience Commission to help lead those efforts. And of course, we need Congress to come and step in and to be able to provide the funding that can expand the medical care from downtown, going into South Phoenix, and going across to Rio Salado. So that's the solution to this problem.
Mary Rose Wilcox.
First of all, thank God for affordable health care, as it is so lovingly called Obamacare. President Obama had the courage to put forward a plan, and the premises of the plan is that every man, woman, and child will have accessible health care that they can access. That is extremely important and cannot go away. I would fight very hard in Congress to keep that. As affordable health care is rolling out, and now it is going to affect small businesses, we must make sure, because this is the chamber conference and many of you have small businesses, that it stays affordable, that business owners, whether they have 5 employees or 50 employees or 100 employees, we need to make sure that they can afford it, that there can be a cost sharing of costs, and make sure that small businesses can participate. How many times do workers not come to work because they do not have health insurance? I served on the Maricopa Medical Hospital for 13 years. Instead of appointing somebody as county supervisor, I appointed myself, and I saw people coming into emergency, almost at death's door, because they did not have insurance. So Obamacare cannot ever go away, but we must continue to improve it, make it accessible, low cost, and most importantly, we must make sure that the wellness element in it is people realize what it is. People right now don't vaccinate their children because they're afraid of it. The wellness portion is a huge part of keeping the cost low in an affordable health plan.